Hey there, it's Dr. Jim. Thank you for stopping by. My topic today is something that I have talked about for over 15 years. I know it very well, and I've presented it to healthcare professionals across multiple states for a long period of time. And the topic is working with the non-compliant patient. Non-compliance. What is it? Why do people do it? What good can come from it? It's a social issue, it's a psychological issue, and a very interesting one. So the very word or words hyphenated non-compliant sounds mean. It has a negative connotation to it, and it sounds like the individual should be punished for something he or she did or did not do. Actually, noncompliance is an older term. A lot of healthcare professionals don't really like using it. They have stopped using it for years now, and they have replaced it with a couple other terms that have lighter connotation, don't sound as negative. Non-adherence. The patient is not non-compliant, they're simply non-adherent. Some healthcare professionals don't like non-adherence either. They prefer patient choice. It's your choice to take your meds. It's your choice not to take your meds. It's your choice to put on your oxygen and go to a casino and smoke cigarettes and blow everybody up. It's your choice. So these words sound a little less militarized, I guess, and they are lighter in meaning. But regardless, this is a serious issue. Regardless of what we call it, regardless of what the behavior is, many healthcare professionals feel very frustrated when patients do not follow up on their advice, when they do not follow through treatments, or when they don't even come back for another visit when they're supposed to and when it's on the books. Even when a person is dealing with a very serious chronic health condition, he or she may still be non-compliant. Think about that. Wrap your head around this one, okay? I have cancer. I have severe diabetes. I have pretty serious cardiovascular problems. I've got all these issues. Maybe I have psychiatric issues. And I'm not taking care of myself and I don't follow through what the doctor tells me to do. Why would people do this? Now, the number one complaint, go ask your doctor, the number one complaint of physicians is that their patients do not follow through on their advice and they don't follow through on treatment recommendations either. But here's a staggering fact, and one that's not funny, it's not humorous whatsoever. A staggering fact and a shocking statistic is over 125,000 people die every single year in the United States because of one reason: medication noncompliance. Not because they're using medications the wrong way or the medication side effects are causing health problems. They're just not following through. They're not doing what they're supposed to do. So non-compliant behavior, this type of behavior interferes dramatically with the effectiveness of treatments for a variety of medical conditions and can lead to very serious consequences, including death. That's why I'm talking about it, and that's why I've been talking about it for 15 years now. It involves a lack of willingness to follow medical advice or your doctor's orders. It can involve the individual's unwillingness to give up their own power, their own control. There's where the psychological stuff comes in. And some people, I have a hard time with this one. Try to understand it, and I will continue to try to understand it. Some people simply do not feel responsible for their own health well-being, or their own health care. Non-compliant behavior can be seen as deviant, irrational, uncooperative, and very problematic behavior. You know what the bottom line is? It's not healthy. It's not healthy whatsoever. So if you found this interesting, I have a lot more. I'd like you to visit my blog and check out topics like this and many others. Until then, thank you for your time. Stay smart and stay well.